The government is pushing hard to streamline veteran care, protect benefits.
Right.
They say they're only targeting waste.
Right.
But then, boom, over 1,000 job cuts hit the VA. So the big question is the veteran community actually buying this message? Or are they feeling, well, completely betrayed?
It's a huge disconnect.
Okay, let's try to unpack this. We're diving deep today into sources that detail this big push for fiscal efficiency within the VA. And maybe more importantly, the intense, really polarized reaction from veterans themselves.
Yeah, the reactions are all over the map.
The basic setup is this. You've got House Republicans, VA leadership, insisting that the core funding for veterans, it's safe, protected.
That's the official line.
They argue any cuts, any efficiency measures, they're surgical, aimed squarely at, decades of waste, fraud, bloated bureaucracy, not essential services.
Things they say needed cleaning up anyway.
Exactly.
Yeah.
But despite those assurances, the veteran community response, it's this potent mix. Some support rooting out corruption, definitely. But there's also deep, deep distrust.
And that distrust is fueled by very immediate things, like reports of mass layoffs.
Yeah, and sometimes hitting critical staff, like people on the Veteran Crisis Hotline. All this against a backdrop of just historically crushing bureaucratic delays that veterans already deal with.
So the timing feels rough.
Right. So our mission today, let's really analyze those claims of fiscal responsibility against the immediate kind of tangible impact that veterans on the ground are reporting.
Okay. And what's fascinating right off the bat is how this whole debate really hinges on definitions. Specifically, how lawmakers are defining cuts versus how veterans are experiencing them, when their wait times go up.
The language game.
Totally.
Yeah.
When you look at the legislation itself, the sources are pretty clear. House Republicans cite the continuing resolution, the CR, and they're technically right on a key fact. There are definitely no cuts in that bill to core entitlement programs. Think Medicare, Medicaid, Social Security. They're untouched in this specific piece of legislation.
Okay, so if those big programs are safe, why all the talk, the political rhetoric about slashing things? Where's that coming from?
Well, it comes down to how a CR actually works. A continuing resolution, basically, it freezes funding at the level of the previous year.
Okay, a freeze. Not a cut.
Not an explicit cut to ongoing base funding, no. The perceived slashes seem to come from making sure that specific one-time projects, often funded under something called Community Project Funding, or CPF, aren't duplicated or extended in the new resolution.
So like earmarks or special projects from last year.
Pretty much. Lawmakers who support this efficiency drive, they frame removing these one-time expenses as just sound fiscal management. They argue, look, continuing to fund projects that were meant to be one-offs is waste.
That distinction is critical, though, isn't it? Because on one side, you're freezing spending, maybe trimming these non-recurring expenses. But if you're a veteran and you just see the overall funding number potentially look smaller, or you hear about projects stopping, you just hear cut. The technical legislative jargon doesn't really matter at that point.
Yeah, precisely. It's a battle of framing, like you said. But it's also important to note the positive things supporters point to in the bill.
Right. What are they highlighting?
They stress that it fully funds critical veterans services. It even includes promised increases for things like the Toxic Exposures Fund and VA medical resources.
Okay, so targeted increases are still happening.
Yes. And they also secured what they're calling the largest pay raise for junior enlisted service members since President Reagan. So the message they're sending is discipline for the bureaucracy, but rewards for the actual service members.
Which ties right into that broader administration goal. Root out the fraud, waste, and abuse. Take that misspent money and redirect it back into actual veteran care.
And this is where the Department of Government Efficiency, DOGE, comes into the picture.
Right, DOGE. Their job is basically to audit VA contracts, find that waste.
And supporters of DOGE, they frame this kind of external oversight as absolutely necessary. They argue the VA, maybe the whole federal government, has suffered for decades from low productivity, lack of accountability.
The argument being, if you don't force an audit, nothing changes.
Essentially, yeah. They believe without that external push, the agency will just keep pouring money into bureaucracy, maybe excessive executive salaries, instead of putting it into direct care for veterans. They see DOGE as the tool to ensure the system is actually sustainable long-term.
So the legislative argument sounds, well, pretty coherent on its own terms. Be fiscally responsible, protect core benefits, eliminate waste.
That's the pitch.
But the minute VA leadership translated that idea, that efficiency drive, into action, specifically these mass job cuts, well, the reports from veterans started painting a very different, much more turbulent picture.
Yeah, the human impact.
You could almost feel the wave of skepticism in the comments we reviewed. Veterans are talking about fears that go way beyond just staffing levels.
What kind of fears?
Concerns about actual benefit. Cuts down the line, talk about privatizing VA healthcare, even worries that the Congressional Budget Office, the CBO, might propose means testing disability pay or even taxing it. These are things that have been floated in CBO reports before, apparently.
And that's the immediate kind of operational paradox, isn't it? Whatever the long-term goal of efficiency might be, the short-term action is cutting the very people needed to process claims and provide care.
Exactly.
Reports indicate over 1,000 VA employees were let go, often folks still on probation. And critically, like you mentioned, this apparently included staff on the Veteran Crisis Hotline.
Which is just incredibly concerning.
For the veteran community, the fear becomes instant. Job cuts today mean longer wait times tomorrow and maybe worse care. It's a direct cause and effect in their eyes.
And honestly, when you look at the current wait times, even before these cuts, that fear seems completely justified. The sources we looked at are just full of painful, specific examples of the bureaucratic delays veterans already face.
Oh, they're disheartening. And they really illustrate the historical inefficiency the administration says it wants to fix. We're seeing reports of veterans waiting up to 7 months just to add a dependent to a claim.
7 months, wow.
3 years for an appeal process. And in one, frankly, tragic case mentioned, a veteran waiting 25 years for final answers on some claims.
25 years.
Yeah, and even for basic health care at a VA medical center, a VAMC, you see reported wait times like 3 months just to get a consult scheduled, 57 days for a primary care visit.
57 days for just a regular checkup. I mean, that's unacceptable in any modern healthcare system.
Absolutely. And then there are the internal VA systems that just feel, well, designed to confuse and discourage people. Take what veterans call VA math.
VA math. What's that?
It's the really convoluted way they calculate combined disability ratings. So let's say a veteran gets a new rating, maybe 10% for a condition that's gotten worse.
Yeah.
That 10% isn't simply added to their existing total rating. It's applied to the remaining percentage of their able-bodiedness, if that makes sense.
Not really. That sounds complicated.
It is. It means a veteran who has multiple service-connected disabilities, documented worsening conditions, can actually see no overall increase in their monthly compensation check.
Wait, even if they have a new disability rating approved?
Correct. Because of the way the math works, adding smaller percentages to an already high combined rating often results in no change to the final number. It fundamentally undermines trust. It feels like the system isn't fair.
Yeah, it creates this feeling that the bureaucracy itself is fighting against the veteran who's just trying to navigate the system they earned the right to use.
And even the supposed solutions seem to get bogged down. We saw reports about the community care program that's meant to speed things up by sending veterans to outside doctors.
Yeah, get care faster in the community.
Well, often the referrals to get that community care take months just to get authorized by the VA. So the fix itself is stuck in the same slow process.
Like a catch-22.
Pretty much. And that lack of transparency, the feeling of being stuck, it just breeds more fear and frustration. However, the sources do provide some important counterbalance here. It's not all negative.
Okay, good. Because it sounds pretty bleak otherwise.
Not every veteran feels betrayed. We definitely see strong voices of support and even optimism in the material we reviewed.
That's right. We saw citations from veterans who report getting excellent care at specific VA facilities. Sometimes they even say the care is way better than civilian care.
Which suggests maybe the inefficiency isn't everywhere. Perhaps it's localized, not systemic, across every single VAMC.
Could be. And this group, the ones feeling more optimistic, they often seem to believe the current problems are really inherited.
From previous administrations, yeah. They argue the new leadership just needs time to fix a systemic mess that was created over, say, the last 4 years, or even longer.
So they're willing to kind of stomach the short-term disruption.
They seem to be, because they genuinely believe that cutting the waste, the fraud, the abuse is the only way to make sure their earned benefits are actually sustainable in the long run. For them, something like the DOGE audit isn't scary, it's a positive step. It's accountability.
Which brings us right to that core tension point, doesn't it? Trying to synthesize this conflict. It really boils down to the challenge of implementing discipline, these cuts, in a system that fundamentally has to run on trust.
Exactly. You've got this legislative push for fiscal responsibility crashing right into the operational reality on the ground. Trying to impose efficiency cuts in a vital, high-trust system like the VA, it's inherently risky.
Because the immediate action the staff cuts directly contradicts the promise of quicker service.
Right. You're literally cutting the people needed to process those claims we just talked about, the ones with the staggering wait times already. It just fuels that deepest veteran fear, that efficiency is really just a code word for dismantling the system or maybe privatizing it.
And the struggle for transparency makes that anxiety worse.
Yeah.
So many comments express concern, just frustration over the lack of clarity. Which jobs are being cut? Which programs are being targeted for these efficiencies? Nobody seems to know for sure.
And that information vacuum, it just fuels rumors. Rumors about privatization, even worries about data breaches veterans asking, should DOGE, this outside entity, really have sweeping access to all their private medical and financial info?
That's a fair question.
And those fears about internal accountability, they aren't entirely unfounded based on past incidents. The sources actually point to a really glaring example of why veterans might distrust internal VA management.
Well, what's that?
Remember the PASS-CT Act? Funds specifically meant for hiring and retention to deal with all the new toxic exposure claims.
Yeah, a huge influx of claims expected.
Well, it turns out that $10.8 million of that PASS-CT Act money was found to have been improperly used for bonuses. Not for frontline staff, but for senior VA executives.
Seriously, bonuses for executives from the fund meant to help process toxic exposure claims faster.
That's what the sources indicate. And when things like that happen, it absolutely justifies why many veterans might actually welcome an external audit, something like DOGE, focused on making sure the money goes to the mission, not just lining pockets at the top.
Wow. Okay, so let's try and pull this all together, synthesize what we've looked at. We've seen the administration's claim. Cuts are surgical. They're aimed only at waste. They protect core benefits, and they even boost pay for junior enlisted folks.
That's the official narrative.
But then we've also seen the veteran community response.
Yeah.
Deep, almost visceral fear about the immediate staff cuts, worries about potential future benefit changes, all compounded by these long-standing historical struggles with VA bureaucracy.
A bureaucracy many already distrust.
Right. And that fear is really only tempered by those veterans who genuinely welcome a focused external effort to finally root out the corruption and waste they feel has plagued the system for years.
So here's the thing. When the government tries to fix systemic problems that have been building for decades through these sudden efficiency drives and cost-cutting measures, the most critical resource they put at risk isn't really the funding level, it's trust. Yeah. The short-term cost of these immediate staff reductions is fear. It's slower claims processing, at least initially. And that happens regardless of the stated long-term intentions of securing the budget. So, the ultimate question, maybe for you listening, is this. In an organization that veterans frequently and sometimes bitterly accuse of operating under a doctrine of discourage, delay, and deny, can structural changes that seem focused primarily on cost-cutting ever truly rebuild confidence? Can that happen without a massive, simultaneous investment in transparency and, crucially, immediate improvements in service delivery?
A powerful question to end on. Can efficiency alone rebuild trust, or does it risk eroding it further? Lots to think about there.